If you like your current insurance, you will keep your current insurance.
Like a lot of states, we're very troubled. Any American should be, that citizens are exposed to perhaps financial ruin for lack of health insurance. It doesn't have to be that way. And I think, honestly, the most imaginative things that have been done in the area have been done by individual states.
Well, I have this shop for over 2 years now. Yeah, I can't afford that.
Here in Indiana, we've approached it a little differently than some. We raised the tobacco tax to finance the program. Every penny of that went into immunizing children, but then the majority went into providing a new health insurance product. It's distinct in two ways. First of all, it's not an entitlement program. We did not expose our taxpayers to unknown and perhaps unaffordable tab. Secondly, most important, it's a consumerist model. The person once qualified pays percent of income basis, a very modest amount into a personal account. System provides the rest. The individual manages that account, and money carries over if not spent.
And I explained to her, I need a couple of surgeries done. Do you think they'll cover it? They were like, yeah. And if you look at the list of doctors, they're pretty good doctors, that accept this kind of health insurance. They actually did 3 surgeries. The funny thing is that insurance paid for it all.
One feature that I think further distinguishes our system responds to, I think, a legitimate criticism of individual or consumerist accounts, which is that some people might short the preventive care as a way to husband funds. So when we issued the RFP, we insisted that there had to be additional preventive care paid for by the insurer, and it's up to $500 per year. So if you're a member of the Healthy Indiana plan, you'll get a reminder each year of any preventive step that applies to you. It's time for a mammogram. It's time for a prostate exam. That'll be paid for by the program, and if you do go take care of that business, you get even more flexibility over the use of any leftover funds as an incentive.
Well, I think it's definitely the right way to go. I mean, you're putting in money into an account. The government's helping you out with the rest. You're going to have to pay for certain things anyways.
Right.
So you might as well have some kind of safe deposit. And then after a year, when you enroll for the program again, for the insurance that is,
right,
you're getting whatever money you didn't use. You don't get better than that.
In the aggregate, it appears from all the early data that it is helping hold down health care costs and spending, even while we deal with and promote preventive measures. I think it's a terrible idea. I mean, its motivation is transparent. It's a way to pretend it's not costing as much money as it does. If you can cram a third of the cost onto the states, then Washington can preen and posture and tell everybody that their new plan wasn't as expensive as it truly was. And it would have very unfortunate consequences in 2 ways. First of all, it'd be completely unaffordable for states, most of which are deep in the red now. We happen to be one of the few solvent states left, but this would be unaffordable for us. I can't imagine what it would mean in Michigan, Illinois, California, these places that are flat broke now, to suddenly have to pick up another great big bill. And this trick of it doesn't cost much for the first 3 or 4 years, it's like a balloon payment to a subprime borrower. It's just not good policy at all. And then the second thing is, at least many of the drafts we've seen would probably wipe out new innovations like our Healthy Indiana plan. And I travel the state on a constant basis, and there are 2 things that happen everywhere I go. Someone will come up and want to tell me their personal success story. I quit smoking. I lost 100 pounds. I got a 100-pound club by now. You know, remarkable things that people have done to take charge of their own health and what all that means. And the second thing is someone will come up, it happened 2 or 3 times on last week's trip, often very emotional, and talk about the peace of mind that has come with our Healthy Indiana plan and how simple it is to understand and how empowered they feel and how happy they are about that.
I mean, I feel a lot better.
People are doing what I always had confidence they could do. That is, make their own health care decisions, manage their own money. They are secure in the knowledge that if they should run through the entire account through some unfortunate medical events, they are covered and protected just as insurance operates in every other context.
Well, I think it's definitely the right way to go. I mean, you're putting in money into an account. You know, the government's helping you out with the rest. You know, you're going to have to pay for certain things anyways.
Right.
So you might as well have some kind of safe deposit. And then after a year, you know, when you enroll for the program again, for the insurance that is,
right,
you know, you're getting whatever money you didn't use. I mean, they don't get better than that.
And I'll be very, very sad if Washington acts in a way that knocks that out from under these folks.
You know, health, you know, if you're not healthy, you can't make money. If you're not healthy, you cannot provide for a family. If you're not healthy, you know, that's the #1 thing. Washington, you need to keep hip. I mean, this is the way to go. This is the way to help people out. You know, you're trying to make some kind of system to help people out with the health. This is the way to go.